Good morning, good evening, everybody. Namaste. I'm Vaidya Asavari Manavikar. I am from Minnesota, and I would love to welcome you all for the CAR Global Webinar Research Series. CAR, Council for Ayurveda Research, is an international non-profit organization based out of USA with its sister chapter in India by the name of Ayurvidya Anusandhan Abhiyan Foundation, AAAF. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No non-profit can actually work or operate and succeed without the volunteers. So basically, we will love if you can join us and if you consider joining us as a volunteer. We can place you in a variety of projects based on your skills and also your interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today. Mrs. Renuka Mahesh Kulkarni. She is a renowned Ayurvedic infertility specialist. She has done commendable work in Ayurveda and especially in the field of infertility, women's infertility, and how Ayurveda can be really beneficial in variety of cases since almost last 30 years. So she has specialized clinic for women's health and infertility at Pune and Pandharpur past almost 30 years. She stood first in Stri Rog and Prasuti Tantra, Gynac, and obstetrics. She specialized painless technique of Uttaravasti by own invented method. She developed innovative technique of Garbha Samskar with the help of Yoga Nidra. Many number of patients of infertility due to repeated IUI, IVF failures, tubal blockage, PCOD, endometriosis, habitual abortions, TORC positive cases, and many more, she treated and cured successfully with only Ayurveda treatment. This is really very commendable. She is a certified yoga teacher. She is born and brought up in Pune, Maharashtra. And for the wide propagation of Ayurveda in the rural parts, she decided to move to Pandharpur, Maharashtra, almost 28 years ago. She has been giving lectures for many years. She has spoken at the Ferticon National Seminar keynote speaker on women infertility Ayurvedic aspect. She has given lecture on Tanava Mukti Sati Yoga Nidra. So Yoga Nidra for stress release at Tirak Ayurved Mahavidyalaya, Pune on occasion of International Yoga Day. She has also given a lecture on Param Ayurved online lecture on women infertility Ayurvedic aspect. Lecture on women's health at Ayurved Vyaspet arranged program. Online webinar at New York, USA, Wonders of Yoga Nidra. She has given many lectures of international students through IAA Ayurveda courses. She has conducted many workshops on various Ayurveda subjects and women's health at California, USA. She has presented paper on women infertility in International Ayurveda Conference, USA, organized by AAPNA, APNA. And during lockdown, she did a fabulous job by conducting many online lectures and teaching so many students and also giving her views as well as her own experience So it was really useful for all the Vaidyas also. So let me invite you. I would love to hear your talk, and thank you everybody for joining us today. So the floor is yours now.
Thank you, Dr. Asavari, for nice introduction. Very, very good job you are doing in abroad. And thank you, Dr. Rajan Padankar, sir, for introducing to this huge platform. And your work is very good. And I will start with the subject without wasting much more time. I will share the screen and we will start with the lecture. Am I visible?
Yes.
Should I do a full screen?
Yes.
Yes.
Definitely.
Okay, thank you. As said by you, I am from Pandharpur. So, Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Para Brahma, Tasmai Shri Gurave Namaha. Our today's topic is woman infertility, differential diagnosis, treatment, and evidence-based with successful case presentations. This is a small, if you want to contact me in future, you can take a screenshot. Now, coming back to our today's topic. Actually, what is infertility? It is described in Granthas much more. But if a healthy couple not having their own child, in spite of using different kind of, if in spite they are not using any kind of contraceptive pills or instruments, they can be labeled as an infertile couple. To this problem, if we are practicing in a clinic, if we consider 4 couples, 1 couple is infertile nowadays, and the number is increasing day by day. Why? There are many aspects to this problem. Major aspects of anapatyata. One of the major aspect is socio-ecological. Our society considers woman as a fertile machine. Everyone feels that after 1 or 2 years of marriage, she should give birth to a child. But at the same time, women are equally educated. They are enjoying their financial freedom, and they are not ready to give up their career, financial career. One of the patient asked me directly, "Who is going to take care of my career?" Here we have to counsel them that obstetric is also a career and it is a time bound. So one patient on phone consultation, she asked me, she was 42 years old and she was from Florida. And madam, my AMH is very low and I want to freeze the eggs, and what should I do? So I asked her, what your husband do? No, I want to search for the husband, male partner, and after that I'm going to conceive. So she's behaving against the nature. Many women like that. They will first complete their career and after that they will plan for the baby. But it is not good according to Ayurveda. Then some couples are having the fantasies of enjoyment of their sex lives. So her body is actually bombarded with different kind of hormones. Empty pills are there. If unprotected coitus is there, they can use eye pills also. Then copper tea is there. If at all pregnancy remains, they can use empty pills. DNC is there. So number of things. Her body is actually bombarded with different kind of hormones, and due to these hormones, her physical, there are side effects on her physical and mental health also. Nowadays, we can see easily in the society, no one is ready to take the responsibility. So number of divorces are also increasing. Extramarital affairs are also increasing. So she has to think twice while planning for a baby. Then there are different kinds of phobia I'm seeing from in the clinic, that they are having the phobia of natural delivery also. Easily we can see in society, number of seizures is increased. day by day. Then some feel that they will lose their hourglass figure. Then we have to counsel them that they many Bollywood and Hollywood actresses, I give the examples, and then they become ready for the planning of the baby. Then some are having fear of intercourse also. Then here we have to counsel that baby's head can deliver from that cervix. So it is not you should not take fear. You should not get fear about that intercourse. One patient I met, she was having the fear of pregnancy only. She asked me, Madam, how I will feel that like a big worm in my womb? It is against the nature. It is a gift given to us, and it is against nature. She was having that phobia. Then willing, not getting pregnant. This is the actual topic we have to focus more and more. Nowadays, life is very busy. I met one couple. She was working from 9 a.m. to 8 p.m. and he was working in a multinational company, US-based company, and he was working from 9 p.m. to 8 a.m. So there was no time for them to plan for an intercourse also. So they are not having the child. When we take a case history according to Ayurveda, we came to know this actual problem. Thanks to lockdown, she conceived, and they are enjoying a baby girl. Then secondary infertility. They are having one child, and second time they are not getting pregnant. Maybe there is one missed abortion, and then secondary infertility is there, and habitual abortions. In Marathi, we can call it as Garbhastravi Vandhya. Here, conception is not a problem, but actually they are getting aborted more and more. So, गर्भाशय की धारण क्षमता कम होती है. Here, what are the causes, actual causes of woman infertility? Physical, psychological, and karma. About the physical, we will say in next slide. Psychological factors are more. I met one patient. She was from Solapur, and she was having PCOD, polycystic ovary syndrome, and married 6 years ago, and she was planning for a baby, but she was not getting pregnant. She actually tried for IVI also, but when we take case history according to Ayurveda, she lost her younger brother due to blood cancer 6 years ago, and after that her menses was irregular. So the psychological factor was more important. So we planned for yoga nidra, shirodhara, and the medicines according to calm her mind, and that worked, and she gave a baby girl, birth to a baby girl. Then again the psychological factors. One of the student, she was actually first she was a COX patient. Then she had taken the treatment for COX. After that, she developed PCOD. Then we cured PCOD. After that, after long efforts, she got conceived. But she was doctor, and she met an accident, and she has to treat her brother-in-law. And after that, she got aborted due to that stress. It is easy because here we have to consider the sattva of the patient. One of the patient got easily aborted after seeing just a boiling wheat water, red water color water in a cooker, and she saw that water and she started bleeding. So here sattva of the patient is very, very, very important. Then karma, we can divide it into two parts. Karma is, in Marathi we call it as Daiva Dete and Karma Nete. I met one patient. She was sitting in front of me, and she was a secondary infertility patient. So she, in spite of having, I asked her, what is your history? So she told me that she gave birth to a stillbirth. So I was thinking that there may be some serious reason like bija dushti. But she told me that in spite of having patulous os and short cervix, she traveled to her mom's place in 8th month. We all know that Oja is not sthira in 8th month. Sometimes it is at the baby, and sometimes it turns to the mother. And as a result, she gave birth to a stillbirth. And after some treatment, she got conceived. Then here, one of the chef was working in front of Agni directly, and she was working on a famous sweet mart. So she was directly working in front of Agni. As a result, her fire element in her body increased. She was having one child before that work started. And after that, every time there was a habitual abortion. So the reason was increased Sharadharmi Ushnata, Sharadharmi heat in her body. So to pacify that Sharadharmi Ushnata or Sharadharmi heat in her body, we have to arrange the medicine which is more in water element and as well as earth element, because we all know that Agni can be pacified with the help of either with the help of water or earth. So it worked and she gave birth to a baby boy. Then I met two patients who were working on uranium, and due to that uranium, both of them were developing heredity form repeatedly. So I asked them to stay away from uranium and then work. They got conceived. Then there was second karma is one couple was sitting in front of me, and I asked them, what do you do for your bread and butter? She told me, madam, I was giving milk in the at the home, delivering milk, but nowadays I had opened a beer bar and selling alcohol. And so I told him, oh, sorry, I cannot give you the medicine because it is your karma. You are getting the curses from different kind of houses because their families are destroyed due to this alcohol. And so here I stopped. So it is for the karma. Now coming back to the physical aspect. From where we learn Ayurveda, man is a miniature of nature. Pindite Brahmandi. Whatever is present in the nature is present in the woman body, and vice versa is also true. So, considering this, while explaining the infertility, Acharya Sushruta gives the classical example of a farmer. What a farmer does if he wants to sow a seed and take a crop. First, he cleans the soil, removes all the debris from the soil, that is earth primordial element, then pours water, that is water element, prepares mud, selects a good quality seed, embed it in that mud and allows the sunlight to fall on that seed. Remember, without Tej primordial element, conversion is not at all possible. So after sunlight, conversion starts, Vayu vibhajayati. So multiplication of the cell occurs, and then ether element gives space for sprouting. And this is the actual Panchabhutikatva of the formation of the fetus. Then this is, we have to understand this, but it is not so simple in each and every case. Then what are the problem areas? Rutu, that is menstrual cycle, Kshetra, there may be some anatomical problems also, bicornuate uterus. Yesterday only I saw a patient, she was having two uterus. One is very senile and the second one is more. Sometimes arcuate, sometimes bicornuate. Sometimes we have to do some surgical intervention in Kshetra Vikruti. Then Ambu, different kind of hormonal levels. Ambu is hormonal levels. We are giving different kind of hormones to the patient, and you all know that hormones work by the feedback mechanism. So in order to balance these hormones, pituitary glands takes the role, hypothalamus takes the role. So here we have to consider these hormonal imbalances very keenly. And after that is the seed, that is bija, ovum in female and semen in male. Then as a problem is having multifacet, we have to give while treating the patient, the method should be holistic. That is, we have to take the complete case history, that is Ayurvedic medicine, which kind of Ayurvedic medicines we can give. If the doshas are more vitiated, we can arrange for the panchakarma according to the vitiated dosha. Then proper diet and regimen is also important. We will see it in the next slide. Yoga, we can recommend yoga, because yoga, after doing yogasana, preferably Surya Namaskar, hormonal levels get very corrected. Then for the stress management, we can advise them to listen Yoga Nidra, give internal medicines like Brahmi, Jatamansi, Shirodhara, and all these things works. So this is the holistic method of healing. Here you can see a picture. We are what we eat. So if we prefer pizza, burger, then we will be like that. And if we prefer a healthy food, we will have the hourglass figure. Here, while explaining the infertility, मिथ्याचारेण ताः स्त्रीणां प्रदुष्टेन आर्तवेन च जायन्ते बीजदोषाश्च दैवाच्च शृणुताः पृथक्. So mithyachara, which includes mithya ahara, that is faulty diet and faulty regimen. What is faulty diet? Eating seedless, genetically modified vegetables and fruits, hybrid grains with lot of pesticides. When we are eating seedless foods, one of the students asked me, from where the seeds will come? We are eating all things seedless, and when they will be produced. So here, while counseling, we have to give them that you should eat pomegranate, you should eat fig or dry fig, which are having multiple seeds in it. You can eat it. The vegetables, like a lady's finger, where seeds are more present, you can eat. Then eating of the fast food, junk food, pizza, burger, and after COVID, stress eating patients are also increased. They are constantly eating. After stress, they start eating and whatnot. Eating of dry and non-unctuous food, which will vitiate rasadhatu. Lot of spicy and sour food. Incompatible food combinations like milkshakes, fruit salads, and milk along with fish. It will actually develop the toxins in the body, armor in the body. Eating of food in odd positions. Everyone watches TV or mobile while eating. It is not advisable according to Ayurveda. You have to concentrate or focus on the eating, chew it completely, let the saliva mix with the food, and then the digestion will be complete. Then the faulty regimen. Here we can see the lifestyle disorders. Here, after COVID, every man and woman are having the lifestyle disorders. They are not following the biological clock, and sleeping in daytime increased. Then excessive use of hormones. Age of menarche is earlier. Then use of oral contraceptive pills. Unprotected coitus is there. They can use a pill to delay the menses. And many girls come to our clinic, they feel that, oh, now the exams are over. They are of PCOD patients, and now I will plan for my menses. They take Primulute N, Registerol, and then as a withdrawal bleeding, they will get the menses. So then after that, so this hormonal imbalance is disturbed, and hormones, I said hormones work by feedback mechanism. So in order to balance that, the body gets strained, is stressed, and we have to give the Shirodhara. I met one patient. She was actually 110 kg, that is 242 pounds. So she was very obese, and she was having scanty menses, and she was just 21 years old. And here Yoga Basti played important role. Then another patient I met after COVID, I met one patient. She was a kabaddi, actually she is a kabaddi player, but due to COVID, her all exercise stopped. And now she was having 126 kg. And after gaining this weight and obesity, she was not even able to sit in the chair. So she was not having the menses. This is a vicious cycle. When the menses are scanty, the weight gains, and weight gains, after weight gain, the menses are more scanty. Then excessive stress. Many patients, many of you must have experienced that in the exams, during the exams, their menses get delayed or early. Many students who are taking part in sports activities, one of them is taking part in a national level shooting, they are having the stress, and after when they are having their competitions, their menses get delayed. So it is a typical excessive stress, chintyanam chati chintanat, which vitiates rasadhatu. Then there is again one thing, no proper sleep at night. No proper sleep, which may be, some of them are having multinational company, working in some multinational company, they are having phone calls, they have to attend. So that is okay. But many are not sleeping due to again and again watching different kind of OTT platforms. Then one patient is late marriage, she conceived nowadays. But after completing their career, they feel that they should take a chance. So number of late marriages is also increasing. Then again, in Ayurveda, there is a different kind of regimen described in Ayurveda. But after watching the TV ads, we came to know that, oh, it's not a fault. It's not her fault. She should work. She should do yogasana. She should do kathak. She should do trekking also during the menses. But actually, there is a bleeding. So there is a wound. So she should follow what to eat, what not to eat. And it is described in Granthas. If you want to practice as a particular specialized practice, you must know the power of Agni, her fire element. She should know first the Kaya Chikitsa. Kaya is Agni, that is fire element. Here, Teja primordial is very, very important for the conversion. When once Agni is good, you can digest anything easily. So we have to be Kaya Chikitsa. We have to correct the Agni first. Then after eating, from Ahar Rasa is formed. From Ahar Rasa, after the action of Rasadhatu Agni on Rasadhatu is formed in female body. While Parinaman of Raktadhatu from Rasadhatu, Raja and Stanya are produced as a byproduct. Excessive stress will not allow Rasadhatu to convert properly into Raktadhatu, so Rasa will be vitiated. We can easily observe in society that if the female is having some kind of stress in her mind, even postpartum depression, they will not lactate her child. They cannot lactate their child easily. So here stress factor is very, very important. I met one Vaidya. She was having scanty menses, and every time before menses, she was having a boil in the breast. So here Rajaka Urdhva Parinaman ho raha tha. So I just gave her counseling, Shirodhara, to correct the hormonal imbalances, and Basti, because main culprit was Vata. And after Basti treatment, she got conceived and she's having now a female baby. So आहार रस से ही शुक्र धातु का परिणमन होता है. From the diet we eat, after proper processing of the digestive fire, semen and ovarian follicles get proper nourishment. So one has to follow the diet properly. So this is important of diet and regimen. Now, coming back to this slide. Here, you can easily see, first is the Malarupa Raja, that is menstrual cycle. Here, Srava, that is secretion is there. And so Vata is the culprit. Due to Vata, this Raja Pravartan occurs. So if we can see the menorrhagia, painful menses, heavy menses, scanty menses, here Vata is a culprit. So here actually we have to see the menstrual flow, observe it, menstrual flow, and then we can conclude that is it vitiated or not. Malarupa Raja. So in this Raja, just now we are using this kind of technology. We can ask the patient to actually take the photographs of that menstrual pad and send it to us, so we can conclude that is it with clots, is it blackish or foul smelling. If increased PMS are there, brownish discharge, blackish discharge, discharge with white discharge, mixed with white discharge. Then after Balarupa Raja is excreted from the body, then the kapha plays important role. Here, Gate Purane Raje Navecha Avasthite. New formation of menstrual raja is formed. So here, she feels very fresh, energetic, and ovulation. Vagina is prepared at the time of ovulation, and healthy feeling. She is having healthy feeling at the time of ovulation. But when we are treating the patients who are not increasing the size of follicle, no rupture of the follicles, then formation of the cyst, formation of hemorrhagic cyst, and endometrium thickness. Is excessive endometrium thickness or thin endometrium thickness. Here we have to consider kapha, and for vitiated kapha, we can plan Vamana. It is from the 12th to 14th days. On 14th day upward, there is a secretory phase, luteal phase. In this luteal phase, Prasad Rupa Raja is formed, and it starts, follicle waits for the semen, and if it is not conceived, then this phase occurs. This phase is of Pitta. So here we can see each and every Ati Pravrutti Sangova, Siranam Granthayopipa, Vimarga Gamanam Chapi, Srotasam Drushti Lakshanam. Here Artavah Srotas Drushti Lakshanam we can see. Here we can easily see the Pitta. If the Pitta is vitiated, the PMS symptoms, in PMS symptom, premenstrual symptoms, aggression is increased. She is having breast tenderness, then irritability, mood swings are there. So if we observe these kind of symptoms in the patient, we should arrange for the viration of that patient. Then she get relieved due to that. Then after, I told you that we have to first think about the Agni, consider the Agni, and take the case according to Ayurveda. Then how to examine the patient? There are different kind of examination methodology. First is the darshan, visual examination. Many senior Vaidyas were doing their diagnosis while the patient is walking to their clinic, and how she is walking, what is her height, weight, is there any central obesity, baldiness of the hair, central hair, upper lips, hirsutism, are there any hair on facial hair are increased, hoarseness of voice is there. If there is some pain in the legs, she will walk slowly. Many women, I feel that when they are at the menopausal age or repeated IVF and IVF failure cases, they are feeling guilty. So we can easily observe their body language. They are feeling guilty. They are feeling themselves hopeless and gave up everything and in depression. After just darshan, we can conclude all these things and many more factors you can with your keen observation. Then after that is the sparshana, that is physical examination. We have to actually feel the patient's body. How is the skin's touch is there? Is it rough, dry, or unctuous? The luster of the skin, which is from where we can conclude about the rasadhatu. Is it hot or cold? Then per abdominal examination is also there. According to Datara Guruji, Udara Parikshan is also important. If there is a dryness or any tenderness, then palpation of the spleen and liver. If they are hot, to palpate. If they are cold, to palpate. If there is a pidana sahatva, when there is a pressing of hands, they will feel the pain. And if after only touching, they will feel them. These are the different kind of methods we have to actually examine the patients. Then we have to examine again nipples, breast also, if there are any clots, because Shukravahe dve tayor mulam stanav rushanaucha. So we have to examine her breast also. So is there any heaviness in the breast? Are there any clots? They are in a position, a good position. We have to do all these things. Then history. Prashna Pariksha is also more important questions. We have to ask about her menstrual history, her past history. She is having any major previous illnesses, the treatments she had taken, what are the hormones acted on her body, different kind of IUI, IVF treatments. So we have to ask all these questions. Then in question we can ask, is there any painful intercourse which indicates dryness or thick hymen, or many more factors, mental factors also. So we have to ask the patient some questions, and after that we can actually come to some conclusion. So there are 8 factors from where we can conclude. You all know the pulse diagnosis. One should learn it from the guru. Then about the bowel habits, heavy hard stools with blood, which will indicate that piles, fissures, or low, which will also indicate the low digestive fire. Then flatulence is there, bloating. Patient tells us that they are having bloating. Diarrhea, not satisfactory. After straining the fecal motion, it is not satisfactory. Excessive yellow, which will indicate jaundice, and black stools, which will indicate occult blood. Even worms are all. She can see worms also. We have to ask her the history of worms also. Then coming to back to urine, is there any burning sensation, urinary, which will indicate urinary stone or excessive heat? Frequency of passing urine. If it is more, then we have to think about the diabetes also. Nocturnal micturition is there. Then urine incontinence is there. If there is urine incontinence, she is in a lot of stress, or at the menopausal age, the position of the uterus is dislocated. So while asking the questions, we have to ask in detail about all these histories. Then examination of the actual tongue. It is said that tongue is a mirror of the digestive fire. If there is a white coating on the tongue, the digestive fire is not working properly, and ama is more and more produced. If there is a white coating, then black patches we can see on the, then black dots that will indicate worms in her body. Then if there is jaundice, you can see yellowish color coat on the on her tongue. Then speech. We can easily observe the pitch of her voice. If she is having PCOD, the pitch is low, tone is low, hoarseness of voice is increased. At the menopausal age also, hoarseness increases. So if she is speaking fast, she is pitta. She is speaking sometimes fast, sometimes slow, she is vata. And very slow, she is kapha. Then touch, auscultation, we spoke about it. Then vision, we can see height, weight, her shape. Feminine features, we can observe feminine features on her body. If she is having the PCOD factor, that is androgen or testosterone is increased, actually her behavior is more boyish, like a tomboy. Then feminine features are absent. We have to observe all these things. Then the figure, the shape, is the figure is hourglass or it is a central obesity, we can conclude from that. So while examining the female body, we have to consider Ashtavida Pariksha, the 8 factors we have seen, Udara Pariksha, per abdomen examination, Yoni and Stana Pariksha, Pratyaksha Pariksha. We have to see, observe PV, if there are any redness, per vagina examination, while per vaginal examination, is there any redness, white discharge, or she cannot allow the Yoni Pariksha, then she may be a case of vaginismus, or there may be some erosion, cervical erosion we can see. So these all the actual Yoni and Stana Pariksha. Raja Pariksha, Raja, how the Raja is formed, is it having clots, we have to ask. Menstrual history, are they regular, 4 days flow, 5 days flow, with clots, without clots, blackish or not blackish, actually healthy menstrual flow is there or not. Then Because after observing Raja, we can conclude about the Artava. Before in Granthas, which ovulation monitoring was not possible at that time, they used to conclude from the observation of menses only. So we also have to ask the details about the menstrual cycle. In the previous history, according to Datar Guruji, chickenpox and measles increases the Tej primordial element in her body, and Artavam Agneyam, if the heat is more increased, and Shukram Saumyam, then she will not get conceived. Here we have to give Ksharadharmi Ushnata is increased, so we can give Rajani Yog and Paripathadi Katha, which is of Sandu company, you can use it. Then the previous treatments taken, what are the experiments on her body has been done, we have to ask. Then we will actually come to the case presentation. One of the patient was, her occupation was lecturer. She was a lecturer in engineering college, married 5.5 years ago, willing to conceive, but she was having a fibroid, and that was operated on 11th of June, 2016. On hysterosalpingography, right tube spill was delayed. Weight gain was 10 kg after the operative. Here, Medasa Urta Margatvat Artavam Nashyati Sriya. She was having the scanty menses. First abortion was there on 25th of December 2017, weak heartbeats. Missed abortion second time in 2018, no fetal heartbeats, and fetal pole was not formed. Rubella IgG, that is torch test, was positive. Serum prolactin was increased. Patient came to Ayurveda on 11th of August 2019. She was willing to conceive. Presenting complaints were acidity, heartburn, acid eruptions, acne, fever with chills, menarche. Her menarche was, took all the menstrual history also. Menarche was, she was 13 years old. Previous menses dates were very regular. You can see 6 days bleeding was there. Inspection of the on-menstrual flow that was vitiated, grathil, blackish and foul smelling. She was having PMS, breast tenderness, irritability, acidity, and itching of the nipples each time before the menses. Here, pulse was vataja and pittaja. Bowel habits, she was having hard stools, constipation, bloating, and she was having the history of worm infestation in childhood. Burning micturition, fragmented sleep, more dreams. Appetite was normal. Previous history, she was lecturer and sudden loss of voice 2 times. She was having pain in left iliac region after each intercourse. Post-operative removal of the leiomyoma. In previous history, she was having chickenpox in the childhood and typhoid. So her Ayurvedic diagnosis was missed abortion due to loss of fetal heartbeats, that is Bijadushti, obesity, acidity, then Dhatvagni Mandya, which lead to Rakta Malapitta and worm infestation. These are the key factors which I have to consider. Then the treatment plan we used for Bija Shuddhi, and obesity and acidity, emesis, that is woman was plant, torch positive, rajodushti, and right-sided dead speed, Uttar Basti, first cycle of Kasi Saditel. Then second cycle for increasing the Garbhashay, Dharana Kshamata, that is endometrial receptivity, Falagruta was planned. Rakta Dhatvagni Vardhana, Rakta Pachak was given. Rakta Prasadanartha, Jingi Sharardi, that is Ananta and Manjista were given. Internal medicines were given for worm infestation. She was having a lot of stress, disturbed sleep, and hormonal imbalances. So Shirodhara was planned. Her male partner was also having low motility due to mild varicocele. So treatment plan was given for him also. For Bija Shodhan, Virachan was done. Woman and Virachan, that is total complete detoxification of both partners was done. Then Shirodhara and Vajikar Aushadha was planned. Then as a result, UPT was positive on 6th of January 2020. Ayurvedic treatment started on 2019. It is a common belief that Ayurveda gives results, very delayed results. With the help of Ayurveda, you will never get results. But all the cases, we are having the results within 1 to 6 months. Here LMP was 10th December 2019. But in this case, conception was not the problem. The seeing the fetal pole, fetal heart activities was the problem, and habitual abortion was there. So she was having on 11th January, she was having an episode of PV spotting. She was very stressed and she was feeling feverish. So I asked her to perform the sonography on 20th of January. Here we can see the gravid uterus with single intrauterine gestational sac about 5 weeks and 6 days. But they are asking about the per vaginal sonography, but I don't allow them to do the PV, per vaginal sonography, because pregnancy was precious and it will get disturbed. So she was anxious all the time. Then again, the sonography was repeated on the 31st of January. Then here we can see the gravid uterus with single live intrauterine fetus with 7 weeks, 1 day, and with good fetal cardiac activity. Both the partners were relieved at that time. On 11th February and 11th March, episode of PVM spotting was there, but no use. I never used hormones, any kind of hormones for preventing this garbhadharana. Then USG was done on 12th of March. Everything was normal, and a female baby was delivered on 1st September. It was a planned seizure due to the previous operation of the fibroid. Here the baby weight, you can see it is 3 kg and it is very nice with good luster. Then coming to the second case, her age was 28 years old and she was a housewife. Her male partner was a professor in the engineering college and she was anxious to conceive. Marriage 2 years ago. She was complaining that profuse bleeding after each intercourse. Actually, she was a case of pinpoint os, that is her os Suchimukhi Yonivapada. Then she was having Arsha, Admana, and a granthi or a tumor on the right side of the neck. Her urine was burning micturition. Bowel habits are hard stools after alternate days, sometimes passing the stools with blood. That indicates Harsha. Menstrual history was 3 days irregular and scanty menses. We can conclude that she was having PCOD, no clots, blackish reddish discharge. You can see on PV, there was a pinpoint os, stulata, obesity, and sleeping during the day was the causes. Here you can see the pinpoint os. Here they had written that she is having the pinpoint os. Then they had done the USG of the thyroid. Right lobe of the thyroid gland appears enlarged in size, that is 3.5 to 1.8 centimeter, and with nodule in a cystic lesion within it. But all the thyroid levels were normal, so no thyronorm or any kind of medicine was given by them. According to us, it was not going to hamper the pregnancy. So we kept apart that part. Then take all the case history. First, I have to do the marriage counseling to both the partners, because her male partner was in a depression, because each time he tries to perform the intercourse, she was having profuse bleeding and she was not allowing him to do the intercourse. So he was depression, is in a depression. So I have to counsel him also that it is not your fault, it is not her fault, it is a fault of the body. So first, Uttar Basti was planned with the help of Sahacharadi for dilatation of the pinpoint os. Then Shirodhara was planned with the help of Jatamansi 30 minutes for 5 days after Uttar Basti session. It was planned on January 2017. Then Anuvasan Basti, Narayan Tel, and Uttar Basti repeated on the February May month also. Treatment continued for the 2 months. And as a result, her LMP was 15th of April 2017. She can on sonography, single live intrauterine fetus, you can see 15 weeks and 4 days on 25th of August. Here also you can see Ayurvedic treatment was started on January 17th. When she was 7 months pregnant, her goiter increased. So I referred her to a surgeon. He advised neomercazole 5 mg. But as it is not safe in a pregnancy, and I was sure that she will not get in a toxic condition. So, and she was in front of me, so it was not given. And as a result, she gave birth to a 3.2 kg female baby. Size of the goiter reduced immediately after the labor. But when we treat the patients according to Ayurveda, we treat the root cause. So again, before removing the goiter, she again conceived and gave birth to a second child, male child, and the family is complete. So it is the beauty of Ayurveda. Then if madam, are you having some time? I will present one more.
Sure, sure. Yeah.
Okay, thank you. She is a case of habitual abortions. She was 28 years by occupation. She was accountant and her male partner were medical representative. Here, conception was not problem. She was the case of habitual abortions. Her signs and symptoms were willing to conceive, secondary infertility 3 years, and she was married 3 years ago. She was having acidity, insomnia, dust allergy, runny nose, and headache also. Then urine was normal, bowel habits normal, menstrual cycle was normal, 428 days, 4 days bleeding and regular. Form of Raja with lot of clots, blackish, foul smelling, mild fever before menses. These all are indicating that she was having vitiated Raja. Then quantity of menstrual flow was heavy menses. Past history, first conception, immediately after 5 months of marriage, but they want to enjoy their married life and he want to settle. So MTP was done by taking the MT pills. Then after that, the pregnancy was there after 6.5 months amenorrhea, 2.5 months amenorrhea, fetal activity was weak, miscarriage was done. Miscarriage was there, so D&C was done. Then second pregnancy was December 17, fetal cardiac activity was absent and there was missed abortion, D&C was done. Here, while taking the searching for the Hetu causes, history of gover, measles and kanchinia, chickenpox at the age of 17 years. It increased the Sharadharmi Ushnata, Sharadharmi Teja primordial in her body, and due to that, she was getting aborted again and again. While investigations, I advised her to do the TORCH test because it is a kind of TORCH. These are the different kind of viruses present in the uterus, which not allows the next garbhadharana to retain in the uterus. So according to Ayurvedic diagnosis was Yoni dosha, Bija Dushti, that is no fetal cardiac activity 2 times, and Avarodhatmak Samprapti, which was blocking the channels. So kapha was more predominant in this case. So I advise, here we can see the report before Ayurvedic treatment. You can easily observe no fetal pole is seen. 2 times this happened. Then treatment plan, according to taking all the factors consideration after Dipan Pachan, I advised Vamana for Bija Shuddhi and Kapha Pradhan Avarodhatmak, that is channel blocking Samprapti, Uttar Basti for Garbhashaya Shodhan because torch was positive. After that, increasing the Garbhashaya Dharana Kshamata, endometrial receptivity. Then treatment was given was a Rajani Yoga, as I said, at 10 o'clock in the morning and 2 o'clock in the afternoon. Paripathadi Kadha, 10 ml with 20 ml of water, Vyanodan, each time after eating, after lunch and after dinner. Then patient conceived. Conception was not problem here also. Her LMP was 28th of March 2018. UPT was positive on 1st of May. Then USG report after 6 weeks of pregnancy with good cardiac activity because Shodhana was done. So all the detoxification was completely done. So good cardiac activity. And I was sure that it is going to get continue. But although I am sure, I advise patient to perform triple test, NT scan also because she has to deliver her baby in different country or different state also because it is a common belief that she has to deliver her baby in Maika at her mother's place. So here you can see the her 32 weeks sonography. Everything was normal. Then started Masanuku Masiki squat from the 2nd month. Rajani Yoga Paripathadi Kadha was continued. Then Suvarna Malini Vasanta, I advised her and started at the Rasayankal, that is early in the morning, and with the help of with Navanita from up to the 8th month. As a result, you can see a healthy baby girl was delivered, which is having good fetal weight, and now she is having a baby sister also with her, and the family is complete. This is my small work, our Supraja family. Every baby is very, very healthy, having good emotional and intelligent quotient, and this is my job satisfaction. Thank you. If you are having any questions, you are welcome.
Thank you so much for such a wonderful, very, very informative lecture and so many cases that you have worked with and explaining all the details about it. And most importantly, what I really liked it is about the role of counseling. So, it's really, really important. It's not just related to the reproductive system and looking at the health of it, but also your manas, right? Your mind and its psychological role is so important. So that was really interesting. And also thinking like a Kaya Chikitsak. So you are not just working again related to the reproductive system, but you are thinking like the holistic approach. So looking at the rajas and rasa and all dhatu, pushti and all of that. So it was really wonderful.
Thank you.
Thank you. Okay, so let's see if anybody has any question. Okay, so if you have any questions, you can just unmute yourself and ask your question, or you can put it in the chat box.
Namaste, madam.
Namaste.
I want to ask first, thank you so much for this wonderful presentation and also sharing your experience. I would want to ask about if a patient comes with the TB of tubes or a history of TB and also blocked tubes or hydrosalpinx, how do you take up that case and what should be the treatment approach which can give us result?
First of all, I was afraid about because I was thinking that tubercular salpingitis, itis, that is infection. But after some time, when I get confidence about myself, I started giving the Uttar Basti and with fantastic results. Then here we have to think about the Vasanta Kalpas. Means you can give Laghumalini, then Madhumalini, and then Suvarnamalini Vasanta. For when the TB is in a active stage, you can arrange for the advise her to take the anti-tubercular treatment. But after taking that treatment, there are some side effects of that treatment. Some patients may feel that they are having hearing loss. Some patients become obese. One of my patient was having osteoporosis, developed osteoporotic. So many side effects we can observe. 4 patients up to now or just now are having the tubercular treatment and they are having tubercular salpingitis. Here we can use Vasanta Kalpas very good. I think I have cleared, and here the Rasadhatu is more vitiated. So we have to consider all the take complete case history. You will get the answer on your own also. But you can arrange for the Uttar Basti.
Thank you, madam. Sometimes when I plan for Uttar Basti, it is a fear in my own mind that there is an infection there. And how do I approach this with Uttar Basti? Because tubal block is different. Okay, you can remove a block. But when a patient with hydrosalpinx comes, then Uttar Basti becomes a little, I get hesitant to do it sometimes. But when I do Uttar Basti, I see infection there, cervicitis and erosion, cervical erosions. But it gives me little I need more confidence. That's why I asked this question from you, that do you go for it?
Yeah, you can go for it, because I also was hesitant first, but nowadays I can use it. And if there are cervical erosions and all these things, you should not plan for the Uttar Basti. First you have to give the douche or Trifalakavad Dhavan of Yoni, and then you can use the Uttar Basti.
Thank you, madam.
Welcome.
Ma'am, am I audible?
Yeah.
Yes. First of all, thank you for such a wonderful session. I feel myself very lucky to hear to you about all these successful cases treated out for infertility. So basically, my question is, what should be our treatment approach while treating endometriosis? Because endometriosis, like grade 4 and all, when we go into the abdomen and see, it's like everything is stuck in, the organs are quite stuck to each other. So what should be the treatment approach in treating such cases? Because the prevalence of endometriosis is also increasing these days, and it has become one of the leading causes for infertility. So what should be our treatment approach and thought process while treating such patients?
Yes, it's a nice question. We have to think. Endometrium is inside the uterus. It is displacing outside the endometrium. So आशय के बाहर जाता है. तो यहाँ पे main culprit is vata. So in these endometriosis cases, the basti plays important role. One patient, she was a roaring gynecologist. She was having grade 4 endometriosis, and each time she has to travel to her state for removing the chocolate cyst. She developed the chocolate cyst and she has to remove the chocolate cyst, and she was having 4th grade endometriosis. But after giving her treatment, considering her vata in her body, then all the factors, as I said, taking complete case history, Ayurvedic case history, the vitiated vata, for vitiated vata, I gave her yoga basti, plant for the yoga basti, and after that Uttar basti, and now she is having twins. So when we are thinking about the endometriosis, we have to think about the vata, and you all know that nahi vata drute yoni, but लेकिन इस सब घोड़े 12% करके उत्तर बस्ती सभी को देना है, ऐसा नहीं है.
So in this case, we need to think about basti. And any specific approach about basti, like which specific basti, or it will be like according to the patients?
You can use Eranda Muladi or Dashamuladi, but Niruha you have to prepare on your own. Then if there are some blocking symptoms, you can use Sahacharadi. If her AMH is low, you can use different. You are having multiple medicines in front of you. You can choose according to the patient's condition.
Thank you, ma'am. This thought process will really help me for the treating the further patients. Thanks a lot. And one more thing, I would like to say, at the starting of the session, I had a conversation with Asavari ma'am. I wasn't aware that she's connecting from US. My husband was in a short out of the topic. Actually, my husband was in Minnesota 7 years back, and I refused him to come there because I thought, what can I do after coming there? And now looking at you, I'm feeling like, oh, we can do something out there. You have been like a source of inspiration for me through this session. Thank you. Thanks a lot.
Thank you so much, Dr. Amruta. Yeah, I mean, Ayurveda is growing tremendously here in the US, and I am in Minnesota past 18 years. And I have been having my clinic as well as I have my institute. So that's how there is a lot of awareness that is raising now.
Yeah, thank you. I'll just keep you as an inspiration for me.
Thank you. Anybody, any other question? All right. Yep. So thank you so much again, Dr. Renuka ji. It was a really, really wonderful lecture. Lots of cases, lots of really wonderful and very, very useful actually knowledge sharing that has happened. And honestly, the things have changed significantly. Like in my regular practice, I see almost all women, actually girls, like at the age of 16 and even 18, as soon as they start menses and there is a little bit of painful menses or heavy menses, immediately they are put on the contraceptive pills. Yeah. Or sometimes there is IUD. So basically the IUD, which is based on hormones, and that's how they do not get period anymore up until they decide to conceive. So there is just IUD placed, and they are not married even, or they are not, so that's how they are really playing with their bodies, and there is no understanding related to how all these things should work and what kind of impact it will have on your body, which I feel is very stressful. Actually, it needs to be changed in the community. Yeah. And freezing of the eggs, that is also becoming quite common practice now. I mean, in terms of Ayurveda, it will be a really good research actually to see how the Prakriti, how it will change overall after the conceiving, if you are using this frozen eggs.
Yes, because congenital anomalies are also increasing day by day due to this technique.
Right. Yeah.
At the age of 42 or 45, she is not at the fertile age, so she cannot nourishment to the baby is not good. So it is going to keep impact on the society. So if she want to give a birth to a supraja, that is a healthy baby, her age should be considered.
Absolutely. Yes. Very true. Yep.
Madam, can I ask just one last question from Madam? It is about, I'm seeing a lot of cases now where young girls are getting diagnosed with premature ovarian failure. And they are coming to me at 23, 25, 28, 20, and even some after doing donor egg also, donor egg IVF fails, they come to the clinic. So with especially regarding POF, what should be our approach as Ayurvedic doctors? Though I'm trying with Vatahara Chikitsa and balancing these high FSH, LH and helping them to get periods. But what else do you suggest in your practice that we should adopt? And also, in your experience, what is the reason that we are seeing so many cases nowadays?
See, number of follicles in her body are decided. When she takes birth from her mother's womb, it is decided. It is not, we cannot increase that number and we cannot decrease. But the thing we are doing nowadays, giving her more and more hormones, inducing her ovulation and taking more and more eggs from her body. So the number decreases very fast. AMH levels decreases very fast. If the AMH is low, you can focus on the quality of the seed, not the quantity of the seed. But if there is premature ovarian failure, I think we cannot do anything, because we give medicines for Vajikar, her Vyadhi Avastha, but it is not working as we feel that it will work.
Yes, madam, I have the same
because
thing.
they are not giving donor egg or receiving the donor egg, they are working against the nature. And
and even donor sometimes doesn't.
her body is induced again and again, and as a result, after injections also, hormonal injections also, at certain point her ovaries stops working. Oh, I will not work anymore. Yeah, please.
Yeah, so I explain my limitation to patient that, we can try. And if it doesn't, then of course, but what they also come for, if you can prepare my uterus for donor egg transfer, because the lining doesn't grow as well in those cases. So they are put on estrogen a lot, but then I think Ayurveda can little bit help these cases if they are planning for an IVF, at least to prepare the uterus for conception.
Yeah, you can. Sure.
Yeah. Thank you.
All right. So thank you everyone for attending our webinar. It was really, really wonderful. And we have recorded this, so it will be available on our CAR YouTube channel. So you can definitely watch this recording again, as well as you can watch other recordings from previous webinars. And we would love you to participate at our CAR, Council for Ayurveda Research Institute. Yes, Patankar sir.
In my opinion, very excellent presentation. But for females or young girls, public awareness and to teach them how to go through our daily and seasonal regime is need of the hour. That is my opinion. And
Yeah.
yes, Ayurveda is great, but we should know the strength and the limitations of each science. So
Yes.
where to stop and where to go ahead, that should be also very excellently explained by Renuka ji. So thank you very much. Thank you. Thanks a lot.
All right. So if you have any questions or if you want to participate or contact us, you can reach out to us at ayurvedaresearchusa@gmail.com, or you can reach out to me at asavari@mnayurveda.com. Thank you again. Thank you so much. Yeah.
Thank you.